This week, the EU's health agency warned that Europe has seen a record number of outbreaks of mosquito-borne illnesses this year. The European Centre for Disease Prevention and Control said that the rise is driven by climate change, which leads to longer and more intense transmission seasons. Tiger mosquitoes, which spread viruses like chikungunya and dengue, are now established in over 3 times as many European regions as they were 10 years ago. For more, we can bring in Thomas Churcher, a professor of infectious disease dynamics at the Imperial College London. Good morning. Thank you so much for taking the time to speak with us today.
Good morning.
Can you start by explaining a bit more about how these diseases spread and why climate change exacerbates the problem?
So these diseases are spread from person to person by mosquitoes, and mosquitoes are cold-blooded, and so their activity and the development of the virus and other parasites inside the mosquito is entirely dependent on the temperature that the mosquito is at. So as the world warms, these parasites and these diseases, these viruses, get more transmissible, and we see more chains of transmission.
Okay, so it's not just that the mosquitoes are sort of spreading because of climate change to areas further north, but the mosquitoes themselves are more capable of spreading the disease.
Exactly. There's these two things going on, which are probably related. As in, over the last couple of years, we've seen these tiger mosquitoes expanding throughout Europe. And these tiger mosquitoes are very good vectors for a wide number of different diseases. And also, as it gets warmer, these diseases are spread from person to person via these mosquitoes much easier.
Can you talk a bit more about some of the viruses that we're seeing getting spread and what their symptoms are?
So there's a whole wide range of viral diseases that are spread by these mosquitoes, ranging from something like dengue fever to chikungunya and Zika. And these diseases are often endemic and common in hotter parts of the world, and they can cause a wide range of diseases, and lots of the symptoms from them are not particularly obvious. So they're kind of fever, headache, other things that you might be getting from other viruses. So it's not entirely obvious when you have a new outbreak of these diseases.
And what about the bite itself? I mean, does a mosquito bite from an infected mosquito look or feel any different from just a regular mosquito bite?
No, it doesn't. You don't really know. Obviously, the nuisance factor of mosquitoes is a real problem, and they're a pest. But you don't really understand whether they're transmitting the disease until you've actually had quite a lot of transmission going on, and actually clusters of cases are together that you actually identify that being an issue.
At this point, how should people in Europe be protecting themselves? I mean, would starting to sleep under a mosquito net, for example, be considered an overreaction?
Well, so these mosquitoes, certainly the tiger mosquito that we're talking about, doesn't actually just bite at night. It bites often during the day and the time when you're sitting outside in the evening. So any mosquito prevention, you getting bitten yourself, will help. But unfortunately, this is an issue that you can't just solve by yourself. It's something that we all need to do together. And so, for example, countries like Singapore, they are very strong in preventing people from having, for example, upturned water things in their garden. That is where the mosquito breeds and therefore acts as a kind of a center for new mosquitoes. So we really need to work together to reduce the number of density of these mosquitoes.
And has the European Union taken any sort of collective action to reduce the spread of mosquitoes at this point?
So there are some initiatives. However, there aren't particularly good ways of controlling these at a population level. These issues have been plaguing lots of low-income countries for many years, and so we really need new ways of controlling mosquitoes and new vaccines to help protect people from these new infections.
When one hears this news, it's sort of easy to imagine kind of a sci-fi horror film scenario where there's the mass spread of a deadly mosquito-borne illness with the onset of climate change. How outlandish is a scenario like that? I mean, is that something that disease experts are preparing for?
In Europe, it's probably not going to be that kind of disaster scenario. There's going to be increased annoyance from these things and increased disease burden from these cases. But it's unlikely that some of the more deadly diseases, such as malaria, will reinvade Europe.
Can you talk a bit about some of the areas in Europe at this point that are the most impacted?
So over the last year, this report highlights that there's been a large increase in the number of, for example, dengue cases in France. And so the number of cases that are locally transmitted. So we're always getting people coming in with disease. But now what we're seeing is small chains of transmission as those people spread the disease to people that haven't got a history of travel. And so what we've seen over the last couple of years is the number of locally transmitted dengue infections doubling every year. So in 2024, there were about 84 cases in France. And I expect that to continue as people become more aware of these infections and start testing for them more.
And as you said, a lot of lower income countries have been dealing with this issue for years. What are some of the lessons that we in Europe could learn from them?
Unfortunately, it's that mosquitoes are very hard to control. These insects are very highly evolved to feed on us. And so we need really good new tools for controlling mosquitoes and the disease that they spread.
And is this a phenomenon that we're seeing perhaps in other parts of the world as well, where they're becoming more vulnerable to viruses that didn't used to be a threat?
Yes, so both because of the mosquito expanding its range, but also because of this increasing temperature, then you are seeing increasing areas where previously they didn't have the disease, and now they do. Because it's a little bit warmer, because the transmission season lasts for longer, you're starting to see much greater cases of these infections in many locations around the world.
Can you talk about some of the other ones other than Europe?
So, for example, in Africa, we have a disease that's spread by Anopheles mosquitoes that transmit malaria, and you're seeing over the history in places like Kenya, these diseases going higher and higher up the hill. And so, previously, high up that mountain, it was too cold for the disease to spread. Now we're seeing, because the temperature has risen, that these mosquitoes are able to transmit the disease in these areas that previously hadn't got any.
All right, Thomas Churcher, thank you so much again for your insight this morning. That's Thomas Churcher, a professor of infectious disease dynamics at the Imperial College London.
Thank you.